I am Dr. Yasruddin Hoti, working as an assistant professor of neurosurgery in Punjab Institution of Neurosciences. So today I have come here all the way to talk about fibromyalgia. So a lot of people ask us, what is fibromyalgia? Fibromyalgia is a chronic disease which actually is manifested by generalized body aches. The pain actually starts from the head. It can be in the chest, in both of the limbs, in the upper limbs and in the legs as well. Some of the patients complain of bloating in the abdomen. They can complain of backache, and they can even complain of pain in the buttocks. They are very much disturbed. They have less amount of sleep. They have difficulty in sleeping. They have difficulty in memory processing. And they have a lot of problems. And this is a very common disease which a lot of people in Pakistan encounters. So what are the causes of fibromyalgia? Fibromyalgia actually results from the signals that go to the brain and they perceive the pain sensation. So they are like problem. There's a nicks, there are the cuts. So the pain sensation doesn't go into the brain and they are not perceived properly. So actually these patients have a highest intensity of pain perception. So that's the main reason. So the exact reason for the fibromyalgia is not known, but it is believed to be the signals abruption. Now what are the symptoms? As I already told in the definition, that the patient will get headache, they will have visual problem, they will have pain in the neck area, pain in both of the upper limbs like in the arms, pain in the legs and in the back and in the abdomen and waist. So this is the basic symptoms of the patients having the fibromyalgia. Now what will cause this fibromyalgia? So a lot of conditions are there. This could be because of the stressful situations patients encountering from stress. A lot of patients deprived of sleep can get this, and because of the socio-economic status and the complex nature of the diseases that the Pakistani population have, so they get the fibromyalgia very frequently. Some of the books says that this could be because of genetics. So genetics has a little bit of role, and the environment definitely plays a big role. If you are in an environment which is stressful, so that will lead to fibromyalgia. So how will we diagnose? So fibromyalgia it's a diagnosis of exclusion. What does that mean? It means that you cannot get it in X-rays, in blood test and anything else. You have to clinically examine the patient. The patient will have typical pains in particular areas, and that is the reason that the fibromyalgia manifests itself. What is the treatment? The treatment of fibromyalgia is very complex. You need to improve the dietary habits, you need to improve the sleeping habits, you need to socially interact with the patient, and you have to improve the cognitive functions of the patient. And after all these, you need to treat it with medications. So basically, 3 categories of drugs are being used. Anti-epileptics, they have a role in fibromyalgia. Anti-seizures medications, they are also known as anti-epileptic. Antipsychotics and antidepressive medicines, and some of the analgesics have a big role in the treating of fibromyalgia. So I think we all have gathered here to talk about the awareness of fibromyalgia, and we can take it very well. All the best. Thank you.